Good morning, everybody. I'm Murtaza Laktawala, co-founder of Twigs. Um, I've known Patrick for some time, talking in the healthcare circles, and recently we reconnected on Twin City Startup Week, and he's like, "You should come in and get some advice from you folks here." So here I am. Please, I'm open to candid feedback, and I'll get into it. So. My background is medical devices. I spent 8 years at Medtronic designing implantable neurostimulators. And about 4 years back, my sister had trouble with pregnancy. It was a very sad time for her family. And as a biomedical engineer, I was like, there has to be a way to help, my sister. So we started looking into it and realized that millions of women in the US struggle each year with getting pregnant. And that's how we started Twigs. We are the next generation of conception. The reality is, today families are waiting until longer to start having kids. As a result, 1 in 5 women have trouble getting pregnant. Solutions exist, but are extremely limiting. Work. This is one step. Yep, solutions exist but are extremely limiting. You have pregnancy tests, ovulation tests, basal temperatures, burning microscopes. There are websites that help you interpret those tests. And even after spending hundreds of dollars trying such products, the result is a feeling of frustration and lost time. And that's where we come in. There are 4 million births in the US each year, and those 4 million families are spending about $1 billion on conception products and services. And that's where our solution comes in. Twigs is a mobile platform that uses a combination of hardware sensors and app-based algorithms to help women conceive. Next, please. All right, our solution is a Bluetooth-enabled modular medical device that fits in the palm of your hand and can measure fertility hormones from urine to predict ovulation, which is the peak fertile time. By the way, it can also confirm pregnancy by measuring pregnancy hormones from urine. Next, please. Okay, next. Yep. So the device talks to a smartphone app via Bluetooth, and the app guides the user in a step-by-step manner on how to use the device. Then the data from the device is analyzed by cloud-based algorithms, which tell the women if it's a peak fertile time for them or not. Next, please. So the science behind the solution was developed under the guidance of Dr. Abby Stewart. She's the head of reproductive endocrinology at Mayo Clinic and author of Mayo's Guide to Fertility and Conception. Next. So if you go online and look for fertility products, literally hundreds of products will come up. And you might think this is crowded. And we kept hearing that a lot. So what we did is we spent some time figuring out our exact target population. So who we are going after are women from the ages of 30 to 45 who are career women who don't want to waste time getting pregnant and who are willing to spend money on a premium fertility product. In that target, we really see competition in 2 groups. First is a product by Clear Blue, which really owns the market more than 50%. It's a joint venture between Procter & Gamble and Earlier Diagnostics. And what they have is a touchscreen-enabled monitor that can measure fertility hormones like us and predict ovulation. However, it's not smartphone connected, so it cannot implement the advanced user interface that we can. Also, you still need to go and separately buy those $10 pregnancy tests each month. On the other hand, there are a group of startups that are coming up with connected thermometers. And those thermometers measure basal body temperature for women. And the science behind that is when the peak fertile time comes, the temperature shifts from low to high. Now, there's a fundamental limitation with temperature-based solution that when the temperature shifts, the peak fertile time is already gone. And it's telling you that your peak fertile time was yesterday, we're going to use it next month. So it's not predictive in nature. Our solution is predictive in nature and can 24 to 48 hours in advance tell the women when their fertile time is. Next. So last year, we talked to a lot of people. We talked to insurance providers, Blue Cross Blue Shield, United Health, We talked to OB/GYN clinics, we talked to endocrinologists, and now we realize that our product is going to be direct to consumer. Our app will be available for free. It's already available in the market right now. And the device will be sold direct to consumer for $149. It will come with a supply of test strips, which are consumables. And for ongoing use of the device or the kit, there will be additional tests available for $20 a month. So we made tremendous progress so far, and we are on fast track for our 2017 product launch. Basically, our technology is completely ready. We've launched our app, iOS app, and we have about 1,400 users who are using the app. Our device is also ready. We are currently running a conception study where women are using our device in a home setting to get pregnant. We've filed our IP, and we are in the first action, office action for the IP. Our regulatory strategy is also well defined because this is a medical device. It's going to be a class 1 medical device, so the same risk as a toothbrush. And now the milestones that we are working on is 6 months of product development so we can get it production ready by 2017, as well as marketing. So because it's a direct-to-consumer product, marketing becomes really important, the brand development, and we are working to do that. Next, please. So vision of the company, so we are a women's health company. We want to do everything to help women from the time they are trying to conceive all the way post-pregnancy. Using our app, our sensors, our tests, and our future tests, we want to help women in all those phases of life. And this is the team that's going to bring this vision to life. Like I said, my background is medical devices. We have other people on the team who are expert in iOS and IT infrastructure. They've developed applications that currently handle over 1 million users. We have a couple of consultants who are helping us with the marketing and brand development aspect of it. We are still working through it. And then we have a regulatory expert who helps us with the regulatory side of things, being a medical device. And just before I end, I'd like you to meet Katie. She's from Indiana. She was trying to get pregnant on her own for more than 6 months before she joined our conception study. Just after 1 month, that is after tracking her hormones for 1 cycle, she became pregnant using our device. And this is what she had to say. So in summary, it's a huge market. We've addressed the technology and regulatory risk. And we are a Midwest-based medical device company with expertise in medical devices. And we are currently raising our first round of outside funding to help bring this product to market. Thank you.
Thank you, Murtaza. Our question that we like to ask all of our presenters is how this community can help you.
Yeah, absolutely. So, in our team, we are good from the technological side. We are engineers. We can do technology well. The thing that we are really struggling with and need help with is marketing and brand development, being a consumer. This is a direct-to-consumer product, and the number one feedback we get is getting into retail, getting into consumers' hands is expensive and challenging process. How are you going to figure it out? And that's where we need real help with.
Thank you.
Yeah.
Good answer.
Yeah.
Let me bring the microphone around to those that have questions.
Great presentation, great product. And my question was going to be about the marketing. So you said you've done really good from what you say of establishing a market, researching that market, getting to the consumers in that area and figuring out what's going on. I think the biggest concern you want to ask the folks when you get to marketing is what's going to happen when P&G tries to push you out of the market. And then are you willing to change the name of your product? Because
Yes.
Clear Blue is pretty easy to figure it out. It's going to be blue if I'm pregnant, and the rest of it, well, Twigs, they might not know. So figure out how you're going to make people want your product over that Clear Blue, and I think that should be your marketing focus when you get your folks.
Yep, absolutely. So the last part is easy, the name, well, Twigs. I mean, we came up with the name, and obviously it's not a great name. As we do the brand development work, we are definitely planning to change the name, which is more talks to the target customer who we are going after. And in terms of marketing, yes, we have like 7 or 8 different things that we know we differentiate from Clear Blue and others in the market. And we are trying to figure out which are the key things that customers connect to. So we are trying to figure that out.
I think that you, first off, have a great idea and a great product.
Yeah, thank you.
Thanks for presenting.
Yeah.
And so, secondly, I maybe would suggest that obviously, if you're not a marketer, you can definitely present and explain the product. So maybe create contacts or connect with CEOs or directors of clinics, especially in spaces and places where this could definitely be used to prevent pregnancy and as well as what's happening for your study patient, help pregnancy.
Yep. Yeah, absolutely. Preventing pregnancy is a 5 times bigger market. We want to go after it, but right now, and the way we see the market, there are other players who have better solutions than ours for preventing pregnancy. So we're going to wait in a watch mode. We think, the target we are going after who are trying to conceive, they are much more motivated and engaged, and we can sell to them. That's why we are focusing on them for now.
Murtaza, is the Minnesota Cup on your radar screen?
Yeah, I'll be candid with you. We applied 2 years in a row, and we've not been able to get through. And I was at the Minnesota Cup final presentation, and talking to people, I got connected to one of the judges who actually looked at our application, and he had some feedback is the differentiation. It's not clear to people who are looking at us how we differentiate with our competition, and that's our major problem right now that we are trying to solve.
Please keep it on your radar screen because you can apply again in March of 2017.
Right.
And knowing that Stomonics was the grand champion this year, you should really consider it.
Yep. No, thank you. Yeah, absolutely. Interestingly, Minnesota Cup goes beyond just getting winning the cup and all that. We've talked to investors, and being a Minnesota company, if you're not in Minnesota Cup, it's kind of a negative signal for people that why were you not in the Minnesota Cup? So from that perspective, we're like, we have to get into Minnesota Cup. Yeah.
I have a question in the back. This might seem like a silly question, but obviously you can inform women and couples when their potential is greatest. So you can also do the opposite of that. And for religious reasons, many people don't subscribe to contraception and all that. Have you thought about that at all?
Yeah.
I don't know if that's a silly question or not.
No, absolutely not.
A lot of people practice the rhythm method.
Right. So the Creighton method is there for preventing pregnancy, and there are other cultural and religious groups have different methods, and we could go after that. Again, it's just been a decision that we made that let's focus on helping women get pregnant. Then we can do a future version that helps them prevent pregnancy. Just because we think it'd be easier to sell to women who are trying to conceive.
Following up with that, I think you'd have, what would it be, legal ramification. Like one way you're trying to help people get pregnant, but if you took the task of helping prevent pregnancy and fail, that lawsuit could take you down.
Yeah, no, I mean, other companies are doing it, and we at least have a medical device that can measure fertility hormones and has a high accuracy to it. So we'll have a higher accuracy. Others are just using app-based solutions where they say, based on the math, you are not going to get pregnant if you have intercourse these days. And they are working. Other companies who are trying to do it is using studies of women, thousands of women. There's a company in Europe that's doing that. And that's the approach you have to take, where you have to compare yourselves to the pill, which is not the healthiest thing for women. And there are companies who are able to make those kinds of claims that this is better than the pill because it's a natural thing without using any medication. And the same kind of accuracy can be achieved. It's just a whole business direction if you want to go that direction. Studies and everything have to be done around those claims, and then you can go after that market.
Other questions?
You mentioned your 3-month study or trial, was that necessary for a type 1 application, and what were the results?
Yeah, no, that's a very good question. In a class 1 medical device, you don't really need a study, right? But when you talk to people, the question is, does this really work? And as a startup, we are like, yeah, we know it works. It's based on the existing science that is well proven. But just to put things into rest and learn things from our women, we did this study. So we got great feedback that this is what they like, this is what they don't like about the product, what their sensitivities are. We have data that shows how accurate our algorithm was with them or when our device failed. So it was a huge learning experience for us, as well as it showed we have 3 women who have become pregnant now. And we have some success stories that we can use for marketing and doing more things.
I'm curious if you've approached any marketing companies or have been approached by any marketing companies, and what that process of vetting those out are versus cost or interest.
Yeah, yep, absolutely. So we thought we don't have marketing talent in our team. We should figure out the experts in the space and partner with them. So we talked to some of the marketing agencies in town, as well as the smaller companies and agencies who have shown to be great marketing, experience in women's health. And it goes all the way from $10,000 to $150,000 work that is needed to do the marketing. We want to spend that money, but we don't have the funding to it. So our goal is we still want to bring that expertise in-house, because long term we are going to be a consumer product company. And we have identified a couple of very great women who have marketing expertise and want to join the team, but they need to get paid. So we are just actively fundraising so we can expand our team and spend the money that's needed for our consumer marketing.
You plan to sell the data, and how do you keep it private?
Yeah, so we get asked that a lot. So this is our data, our user data policy. Obviously, women's health data is a highly sensitive data. We protect it. Our data policies, we don't sell it to women, to anybody, because we don't have to. We make money using our device. So we don't need to sell the data. The data we collect, we aggregate that over the entire population of women that we have to improve our algorithms, to improve their accuracies, and look for big patterns. On top of that, the data we get from individual women, we use that to customize the feedback to them. So for example, if a user has been using the device for 3 months and still not pregnant, we can analyze the data and tell them that, you did not ovulate 3 months in a row, you might want to go see a doctor. So that's our vision, to analyze the data and give women feedback to get medical help. We are not required to be HIPAA compliant, even though this is medical device data, but the expectation is that data has to be secure, so we are in the process of implementing encryptions and HIPAA compliance.
So, 2 questions. One, why Twigs? And when understanding kind of where you want your brand to go, what's your one sentence why this should exist? Like, just to say to me.
Yeah, so, we are focused on women's health. We want to help women take control of their health. When we talk to women, the one thing that we heard is going through the process of managing their fertility is a frustrating process, and they don't have any control over it. So we want using our solutions to help women take control of their health. And we are going to provide them all the tools that they need. The device that we've developed is going to help them with the first aspect, which is to get pregnant. But then once they are pregnant, we want to help them monitor the health of their pregnancy. So how well is their pregnancy? Post-pregnancy, using the same device, different kinds of consumables, we want to help them monitor their health. Post-pregnancy, for example, things like infections, vaginal infections. My wife used to get that a lot after delivery of her first daughter. So using the same device in other aspects of women's health, helping them take control of.
Right, which I completely agree, and it's very technical. So when coming from, you're clearly a very talented engineer, but if you're trying to brand this product and you want it to be about security and I forget the other term you use, but
Control.
Twigs is kind of
Yeah,
that's,
well,
that's
Twigs.
fragile. That's
Yeah.
that kind of makes me feel like, oh, it's gonna break or something. So like really understanding just the absolute feeling you're trying to capture, not necessarily the technical delivery of the service that you're offering, but
Right.
exactly kind of the consumer experience, even just whenever they see the product written, we're not even using it. Like that's something that would I think is a really good exercise to try.
Right. Absolutely. I mean, the name, the name is purely technical. It's based on the solution versus, feedback we've gotten is Twigs. Twigs are barren, and we are trying to help women get pregnant. It's like a terrible name, right? So, we understand that, and we want to definitely rebrand. And like you're saying, going through the process of understanding, what kind of messaging resonates with women. Yeah, we need to figure out the brand personality.
And actually, my question was kind of partly that too. I was going to ask about distribution, your distribution vision and plan to get there, which obviously involves market positioning.
Yeah, so the distribution strategy that we have is in 2017 when we launch, we are just going to go direct to the consumer through our online marketing channels. So using our website, sell it through digital marketing ads, Facebook ads, Google AdWords ads, and then affiliate marketing. So we see that in this space, women read a lot of blogs, and there are a lot of influencers in this space. So we want to reach those influencer bloggers, and through them do a affiliate marketing campaign to get women to start using our product. So first year we want to do that, sell as many as possible, and from that learn what worked, what didn't work, maybe do a modification to the existing product. Then by 2018, go into retail. We've talked to like 50 women, and we know that most of them buy it from retail stores and pharmacy aisles. So we have to get there if you want to get like big revenues and big sales numbers. So 2018 is when we want to go to Target and pharmacy aisles.
So right now you're looking at needing money for marketing and then manufacturing.
Right.
Do you have a manufacturer already, or are you just working with prototypes?
No, yeah. So we have talked to multiple vendors. So at Medtronic, I used to manage outsourced product development. So that's my expertise. We've quotes from for 500 to 10,000 units a year. What's going to cost us? Yes, we verified manufacturers for this.
So what kind of money are you needing right now?
So we are trying to raise $750,000 to get to market for basically those two things: marketing and getting the device into production. Yeah.
Wonderful. Thank you, Martaza.
Yeah, thank
Great
you.
presentation.
Yeah, thank you for the opportunity.